All right, we're live. Well, welcome everybody. Thanks for being here and taking part in this wonderful occasion. What I like to call COVID versus male infertility. A few years ago, I would have never imagined we'd be having this conversation, let alone on a social media platform. This is really what I think COVID has brought about is people have gotten very clever in being able to bring this information out to you. It's amazing how COVID has turned around our daily routine and has really thrown a number and caused a lot of issues, but at the same time it's brought us about and made us better, I think, in the sense of as a society we're working together better. Look at how quick we were able to get a vaccine. It's amazing. And so today I want to talk about a couple different things. I think it's incredibly important to bring about awareness, because when you think COVID, you think, oh yeah, it does a number to your lungs, causing shortness of breath, fibrosis. Once these particles get in there, it can really mess with your pulmonary system. But it also has these other aspects beyond just the, oh, I lost my sense of taste and smell. And I think it's incredibly important that we continue on trying to figure out what exactly is it that this is doing to our fertility, to a man's testicles. I applaud a lot of the work done by our doctor scientists, especially here at the University of Miami, Dr. Masterson and Dr. Ramazami, good friends of mine. I think they're doing a great job, and they should continue their work so we better understand what is exactly going on and what we need to do to be able to beat this. And so I want to talk about a couple different things. I think this is a great point, a great way to bring about this awareness, but also to bring about awareness of some other things such as sperm banking, sperm freezing. We all want to have a backup plan just in case. And the idea of being able to have that backup plan, especially for somebody who's in their fertile years, maybe getting a little bit older and worried that something may happen. Well, something's happened, and we know that COVID is affecting a man's ability to produce sperm, produce good quality sperm. And so something like sperm banking, which is very simple, you provide a sample, they put that in a special medium, and they freeze it at, I think it's something like negative 200 degrees Celsius. Really cold to keep that there for a rainy day. And I think this is another wonderful way of being able to bring this to people's awareness that this does exist and something you can do. So let's talk a little bit about COVID. Again, we talked about how COVID can do a number to people's lungs. It can mess with their heart. It can mess with any organ. The pathognomonic stuff, which is the lack of sense of taste and smell. Well, we all know that is something, oh, if that happens, you better go get tested because it's more likely to have COVID. But nobody really understands at this point yet. We have an idea and we're developing an understanding as to what exactly can this do to a man's testicles. There's a couple of theories out there, and it's probably a combination of a lot of different things, and we'll go over some of these theories as to what exactly happens to a man's testicles when they get infected with the COVID virus. The first theory is that the COVID virus itself has like a fob, or it has a key, or it has the code to be able to get into the actual testicles. And the way it does that is through these receptors, what we call the angiotensin converting enzyme receptors. This is something we find throughout our entire body, mostly in our arteries and veins, and that's why this can affect your heart. But we also find these in the receptors of the testicles. There's three major cells we're dealing with here. The Sertoli cells, which is easy to remember. Sertoli makes sperm, S and S. The Leydig cells makes testosterone. That's the two predominant functions of the testicles, is produce sperm and make testosterone. And the sperm cells themselves all have this receptor that allows the virus to come in and boom, open up, and then allows it to go in. So this is theory one. This is what we initially thought, because we've been able to find the virus in men's testicles on autopsy and a man's ejaculate, albeit we know it's probably not a sexually transmitted disease. Not a good excuse not to wear protection either way, but you can't really pass it through in a man's ejaculate at this point. We don't think you can. And that's because although I told you there are these receptors, there aren't a lot of receptors in the testicles, in the Sertoli cells, Leydig cells, and sperm. And so we understand and we know that although this may be one of the theories, it's less likely the predominant theory as a direct inoculation of these actual cells. Theory number two is this can affect a man's ability to be able to produce testosterone and to have normal levels of androgen. We see in men who have very high levels of virus, people who are very sick from this virus, an increase in some of the hormones that we correlate with infertility. So FSH and LH, which are things that are produced by the pituitary gland, we use them as markers. And for example, FSH When it goes up, well, in a woman, we know that that's directly correlated with potentially menopause or going into menopause. And same thing in a man for andropause, which is a real thing. And so we see that in these patients, an increase in FSH and LH and a decrease in testosterone and estrogen. So we think this may also be affecting not just fertility, but also men's sexual function, the way they feel tired. The third and fourth theory is probably the more likely the predominant aspect of why a man's fertility may be affected by COVID. And that's number 3 is the big one, inflammation. So what happens when COVID gets into your body? Well, in the lungs, for example, it creates all this inflammation by causing what we call a cytokine storm. And this cytokine storm brings all of these inflammatory mediators that will then get your body to produce all this inflammation, which causes scarring and causes really whatever organ system you're dealing with to shut down. And the same concept happens in the testicles. You see this cytokine storm, this inflammatory storm that gets into the testicles, and what happens? Well, the testicles themselves have a wonderful barrier that prevents anything else from messing with them. The best way I can describe it, I'm sure there's a lot of Game of Thrones fanatics out there. You had the Great Wall. Well, this is like the Great Wall. It prevents this microenvironment that's really privileged and doesn't allow things to get in and out. And when you have all this inflammation, well, that wall, it's like the ice dragon from that episode. It just tears it down. It's like somebody dropping a bomb and creating now all these pores and holes in this wall. And we think this is probably where a lot more of these virus particles get in, is through this route and not so much having the key. And so once the inflammation gets in, you have all this destruction that can happen to the actual function, the Sertoli Leydig cells in the sperm, and we see it. We see it with the decrease in morphology and motility, a decrease in the concentration. So inflammation is a major factor here. Fever, number 4, is another major one. And we know that the testicles like to be at a certain temperature. That's why when somebody is hot, testicles drop. Somebody's cold, they hide real close to the body. And when somebody's having fevers because of the COVID virus, especially those that have had high viral loads, like long time fever, many days of these high hyperexia or very high levels of fever, that's really going to affect the testicular function, effects spermatogenesis. The last 2 theories, which again I think we all think is more of a combination of everything, is side effects of medications. So corticosteroids is a very common thing that people take when they have COVID. Interferon, these are all things that are great to help your body try to recover from this, which is incredibly important. Forget fertility, you want to survive this thing, but it can definitely cause a man to take a hit when it comes to fertility. The last one is the psychological effect, and this is something that's very interesting. We know that psychologically, when somebody's under an incredible amount of stress, what does your body produce? Your body produces stress hormone. This is fight or flight. These are stuff that we use to survive stressful situations. Cortisone, epinephrine, things that evolutionarily were meant to allow us to survive these stressful situations, and evolutionarily we were not meant to reproduce during times of stress. And so we know that the psychological aspect also has a major factor as well. Again, it's probably not just one, it's a combination of everything, but the theory here is mostly in the patients that have had really high viral loads, got really sick for a long period of time, high levels of very high temperatures when they had the COVID. Maybe they also had some other risk factors, such as somebody who has had already some prior surgery and they don't have that wonderful fortress around their testicles, that blood testes barrier is no longer there. These are all people that are at risk. And so now that we know and we're having a better understanding, the question is, what should you do? And we don't quite know, and we don't have the final recommendations, but the thought process is, if you've had COVID, especially with high viral loads, if you were the type of person that had COVID and you ran a full marathon while you had the COVID, you're probably okay, because it's unlikely that you had a lot of damage done to your body. But those that did probably should get evaluated. And if they were in the middle of trying to have a pregnancy, whether it be through natural means or assisted reproduction, you probably want to hold off for a little bit after getting evaluated by a urologist that is subspecializes in male fertility, or you go see a reproductive endocrinologist, and at that point then you really can decide, hey, when should we do this? How long should we wait? At this point we're thinking maybe some weeks, maybe some months. It takes some time for your body to recover, and we do think that people should recover from this. But you want to give yourself some time to be able to let your body recover from this, just like you would with regards to the other aspects of what COVID can do. You don't have COVID recover and then go run a marathon. You got to give yourself some time to let your body heal. Now, of course, if you bank sperm, wonderful. you have your backup plan there. You don't necessarily have to wait because you got your stuff there, especially if you're deciding to proceed with reproductive assistive means such as intrauterine insemination or in vitro fertilization with ICSI. So in a nutshell, that's more or less what we're dealing with at this time. As a urologist that subspecializes in sexual medicine, andrology, and male fertility, obviously something I'm very passionate about, something that I like to provide and allow people to learn a little bit more. I find this incredibly educational, entertaining at the same time. It's never a boring moment, as I say, in the field of urology. But I think at this point, now that we've made these introductions, I've given you a little background about what exactly is going on when somebody has COVID and what could be going on with their testicles. I think we're going to open up. I have some questions here that were sent to us previously by a volunteer. And hopefully these are some questions that people may have. I know that I've had conversations and personally seen many patients in my office. I've seen the full gamut of patients that have had COVID, and when they've had their semen analysis, they look perfectly fine. And I've had patients that have had COVID and we did a semen analysis, they actually had 0 sperm, what we call Azospermia. Again, it's a combination of different things. We don't quite understand it. We think the people that have had higher viral loads, and this patient in particular that had Azospermia also had prior surgeries done to his testicles. Remember, it doesn't have that fortress, that protection. And I've seen patients who have had recovery with some assistance in a lot of their semen parameters on their semen analysis. So the first question that was sent to us was, I was tested positive last year in 2020 in April. Is there any procedure for me to find out if I was affected? And yes, the workup for a male fertility patient involves obviously the visit to get the history and the physical, to learn a lot about some of the other risk factors that we want to know about that we already discussed. The tests that we order, other than the history and physical, involve some blood work to check the andrologic side. Remember, I told you these Leydig cells produce testosterone, which gets converted to estrogen. We check the pituitary gland because we know that the pituitary gland that's in the brain can also be affected. And then we do an ultrasound to make sure we're not missing anything architecturally. And the most important thing is the semen analysis. And of course, this semen analysis is done at certain labs, Conception, Florida being one, to be able to give us the information that we need with regards to the volume of ejaculate, which we know is a combination of fluid from the prostate, seminal vesicles, and testicles, the concentration of sperm, what do the sperm look like, so the morphology, how do they move, how well do they move, that's the motility. These are all things we're looking for, and we even also look for inflammatory cells in certain settings, which can be explained either by the COVID virus or even some other prostatitis, which is inflammation of the prostate. So that it would be the main ultimate test that you want to order initially for anybody that is coming in with this issue. The next question is, if there is a procedure, what do the results consist of? I think we talked about that. We're looking at a man's ejaculate, and so we're looking at volume, concentration of sperm, volume of ejaculate, concentration of sperm, motility, how well do they move, so forward progression. We don't want the sperm little guys doing this, we want them to go straight to the target. We're looking at morphology, how do they look? We're looking at certain pH, the pH of the actual ejaculate. We're looking to see if there's any inflammatory cells there. These are all things that are involved in looking at the semen analysis. The next question is, what are or their common symptoms I should be aware of with sperm damaging? Typically, if somebody does have some sperm damage, unless you have the clinical findings of this inflammation we call orchitis, so the testicles getting inflamed and developing a lot of discomfort, maybe some redness, heaviness in the scrotum, fevers. These are all things that we use as symptoms for to make us aware of, hey, there may be something going on there. But even with that, you can be completely asymptomatic and still have sperm damage. Matter of fact, I'd say that's probably the more predominant situation. The more common aspect here is that you're going to have somebody who actually has no symptoms whatsoever, and they may have some damage there with in their semen analysis. The next question, to be safe, what are my options as a former COVID patient, Dr. Martinez? And so we know that if you do have a good semen analysis, and let's say you do want to bank sperm because you're worried long-term effects, what if this later on, does this mean that this is going to accelerate my andropause, menopause? This is essentially testicular failure, where the testicles can potentially start to not work as well. you have the option of doing some banking of sperm and keeping that for a rainy day. Of course, other things that you can do is continue to live a healthy lifestyle, stay away from other things that could potentially damage your testicles. Semen analysis is major, maybe continuing on and following up long term with your urologist or your reproductive endocrinologist. If you're a woman and you're worried, these are all things that you should be doing. I think there's a question here. Do you recommend the PGT? I'm not quite sure what PGT is actually. Maybe if you can elaborate on that. I'm reading now on some of the questions that are being sent. Let's see if they send it. I don't see it. I see a lot of people still joining on, which is great. If anybody has any questions, please feel free to send them. I think you can also try to chime in and call. Here we go. Somebody's doing IUI soon. I have an appointment April 16th. Not a question, it's more of a comment. Congratulations, I'm hopeful that everything's gonna work out there. And again, I think if you, as long as you haven't had the COVID, I don't think there's a problem. You know, with regards to IUI, if your husband had COVID relatively recently, because he's gonna have to provide a sample to be able to do IUI is intrauterine insemination. You need to have a certain amount of sperm to be able to do that. I would say, I would recommend that your husband get evaluated by somebody like me or a urologist just to make sure that we're good. But if he has had COVID, I don't see a problem. I see now PGT genetic testing with Dr. Hernandez. Yeah, again, I deal mostly with, pretty predominantly from a male fertility side, just the male side. So yes, that would be a good question to ask our good friend Dr. Armando Hernandez Ray. Does a high FSH correlate with low T or just fertility? So this is a great question. We know that there is a lot of cross, both Leydig cells and Sertoli cells talk to each other. These are the predominant cells that make up the testicle. And so FSH, which is created by the pituitary gland and stimulates the Sertoli cells to produce sperm, we know that that's the predominant, that's what we use it mostly for. But realize that the testicle themselves, what you're going to see first when a man's testicles start to malfunction or not work as well, is changes in their fertility, their spermatogenesis. Because it's a lot more sensitive of a process for a testicle to make sperm than it is for it to make testosterone. So there is a correlation, but not as much. Once we start seeing the high LHs, that's when we worry about issues with low testosterone. We have been asked if the vaccine can cause infertility. At this point, we don't think so. And actually, we think that the virus itself, getting infected by the virus, is a much higher risk of developing fertility issues with regards to not being able to, having the virus and having testicular damage. PGT for embryos. There's one more thing that I think I mentioned with regards to the male. We don't think there's any transgenerational issues. In other words, if you get pregnant, it doesn't mean you're going to pass something along because you've had the COVID virus. We think that doesn't happen. So I suspect that he may say that there shouldn't be any issues with that. But I'm going to leave that one to him because, again, I don't really deal with the female fertility side. Some men are prescribed clomiphene for better sperm. Any studies that would help if a man has COVID? Absolutely. I think if a man were to come to me and has had, let's say, COVID and has certain findings that we're concerned, hey, you've had some damage. As a matter of fact, that is exactly what I have used. That combination with HCG, the way Clomid works, clomiphene citrate in men, is it'll make your pituitary gland produce more of this hormone, LH and FSH, which in turn will stimulate the testicles to go on hyperdrive. So it makes your testicles work more efficiently. We use it all the time for men who have, especially younger men who have hypogonadism, low testosterone, to help the testicles work better and produce more testosterone as opposed to putting somebody on testosterone and shutting down testicular function. We use it to help guys produce more and better sperm with regards to increasing the actual concentration, morphology, motility. And so, yeah, Clomid is a wonderful treatment that we use and I have used and will continue to use for any man who's especially showing any sort of damage with regards to their testicles for COVID. Is it safe to take Cialis and be vaccinated? It's safe to take Cialis with pretty much anything other than nitrates. So it's a wonderful drug. A little different, not going to do much from a fertility standpoint unless you're having trouble maintaining an erection or getting an erection when you're having sex. So if you're having that issue, feel free to take as much Cialis as you need. Don't pass a 20 milligram dose, and you can get vaccinated all the time while taking Cialis. Not any issues. There's no issue there. Great questions. Got people still getting on. Any other questions? I think we're going to have to wrap this up soon. All right. Well, it's a pleasure. Thank you so much. Again, Dr. Daniel Martinez from Urology Specialty Care. Feel free to reach out to us if you need anything. And remember, if you protect yourself from COVID, of course, most important thing. If you're worried about something with regards to having COVID infertility, there's plenty of resources out there. I'm happy to see you guys in the office. And of course, for the females that are having any issues, feel free to make an appointment here at the Conceptions, Florida. And don't forget Sperm Banking. It's wonderful. It's a great way to be able to prepare yourself for any sort of rainy day, okay? You guys